Good evening. My name is Terry Gregory, and I am in the psychopathology class right now at Houston Baptist University. And I was tasked with finding a inpatient facility with which to find someone to interview there. Uh, it was not without problems, but I made some phone calls, talked to some other people, and finally, someone from St. Joseph's called me back. Her name was Ozzy Hubbard. She is a nurse practitioner in psychiatric nursing. She's had her NP license or whatever they give them since 2021. She came here in 20 for COVID, and it winded up being an opportunity for her. So she stayed with the present place where she works. She works for St. Joseph's Hospital. They have a psych hospital, which is within their complex. It's called the Cullen Center, and it sees all types of patients. Um, it specializes in substance abuse, depressive disorders, more major disorders. Uh, they do motivational talking. They do CBT, which is cognitive behavioral therapy, and they do group therapy. The size of the facility is 120 beds. She said that they are the second largest hospital in the Houston area, and they stay at around 70 patients. Right now, they have 75. I was allowed to go up to the floor, and I asked her, I don't know anything about these patients. Is it safe for me to be up here? So she told me, of course it's safe for you to be up here. We have you first of all behind the desk, and everyone around you is trained in how to deal with a angry patient, and they know how to not let things escalate. So you are safe. She talked about major depressive orders because they see a lot of people with that. Some of the questions I asked with some that were on my sheet. How long is the a usual stay? She told me 5 to 7 days, and I found that interesting because if there's someone that's got some major depressive order or they're suicidal, I'm pretty sure they'll probably stay longer than that. But she said the average stay is 5 to 7 days. They have an 8 bed place. It's the intake place. That's what I'm going to call it. And what they do there, they do the intakes, confidentiality, all these things. They do it there. And I asked her about diversity. She said the hospital patients were very diverse. They even have 5 to 10% international patients that come from other countries just to get treatment there. So, like I say, I didn't know St. Joseph had a psych ward. She said the majority of their patients are like African Americans and Hispanic people, but they see white, they see Asian, they see a variety of patients. Um, let's see, what else do we need to do? Oh, who runs the facility? She said the facility was owned by a group of doctors, and the board of directors are the ones that make all the decisions as far as how the hospital runs. And how long has the facility been there? She said since the 70s or 80s. Again, I never knew this, and I've been in Houston all my life. I didn't know they had a specialized psych type place. Um, um, I asked her, how do they address cultural diversity? She said, first of all, they have diversity training. Then they have like in services. I think she said once a month they have in services on how to deal with other cultures, with other ethnic backgrounds, things like that. So they try to make the patient feel welcome. They try to build a trusting relationship with them. They don't just, they don't just ignore them because they're this or they're that, or their diagnosis is this or it's that. They truly take an interest in the patient. Um, excuse me. Um, the hospital is sponsored by, I think, Catholic nuns. And so there is a religious aspect there, but you are free to have a chaplain, or you can have whomever you would like to come in a religious way to be respectful of what your thoughts and your beliefs are. So they do have, they even are diverse in their faith-based issues. Um, Well, when I was there, because it does ask what uh, what my thoughts were. Well, I was unsure as to what it was going to be. I was a patient in St. Joseph's, and I did not have a very good stay, and that was years ago. So I'm not that keen on trying to go there for anything. And I've had some relatives die there. Well, they were going to die anyway, so I guess I can't hold that against them. But to be back in the hospital, it just kind of brought back some bad memories for me. And but I'm glad I went because I learned a lot from this person. She's very enthusiastic about what she does. Unfortunately, she has a new opportunity coming up where she came from, which was Washington. So she'll be going back to Washington in a couple of weeks, and I really hate that because um, we kind of bonded when we were talking. We like we've been friends forever, and I like being around those type of people where they have the patient's interest at heart. It's not just a job for them. They really like what they're doing. And to me, the patient will have a better outcome from having someone who is concerned about them and what they need. Um, there were no names that I could see of located outside the doors. And what that is they have a medical record code number that's outside their door. And by that code, you can identify the patient, but not just anybody can. I can't look at it and tell, it's just a jumble of numbers. So I would never know, oh, but that's Miss Johnson. I wouldn't know that. So that's only privy to the people that work there. They are a little rattled about trying to let people in right now because of the COVID. I know that people say it's over and we shouldn't be concerned like we were, but it's not over, and it's a lot of issues that are still being taken into consideration. And then because they are a hospital, they say they have to be very, very cautious as to who they let in because they cannot allow someone in that's going to breach the patient's confidentiality or that is not the person who they say they are. So they do have LPCs that see patients and work them up, intake them, and see them. So we talked about that a little, and that was one reason I was hoping she was going to still be there because I said, well, maybe I can talk to them about an internship. But I don't know that that would be somewhere I would want to go if I were just going on my own. I'm trying to think what else I needed to say about this lady. Um, I believe that's it. It was a nice visit. I was there for more than an hour because we were just talking. And she was willing to answer my questions. She wasn't afraid I was coming in there to kill her, take over, or whatever these other places were afraid of in having people. So I did it. I did like that experience, and I would have loved to see more of the workings of what they do there as far as therapy, how they decide who goes where. I would like to see, and I know that'll be coming in hopefully the practicum or the internship, where you'll get an idea for real what they're doing. So I did enjoy that, and I appreciate this assignment because it taught me a whole lot about things that you read about, but now you can kind of put a picture together with it. When they keep constantly telling us about confidentiality, they constantly telling us about informed consent. They're telling us to bond with the patient, be genuine. You know, inspire the patient to want to do better, and the attributes where you shouldn't be biased, where you need to be aware of your own self before you can help someone else. Thinking about transference, counter transference. She said all that's real. She said she hasn't experienced the counter transference, but she has experienced transference. So if you should need her phone number, I do have that. Again, it was St. Joseph's Hospital. It was the Cullen Building. It was the Center for Behavioral Care. Thank you, Dr. Jabber.